My name is Hector, and I will be performing my skills tracheal care and suctioning. Before I enter Mr. Doe's room, I will be assessing the physician's orders and determine when was the last time he had the care, reassess the time. So it is due. So I will make sure that I have the right patient's room before I enter. Hello, Mr. Doe. My name is Hector. I am your student nurse today. Today we will be performing trach care, cleaning and assessing. Before we start, can I have you verify your full name and date of birth?
John Doe, 0721.
Okay, thank you, Mr. Doe. I will be giving you some privacy, both sides, performing hand hygiene. Like I said, we will be doing tracheotomy care, seeing if there is a need for suction, cleaning out the stoma, your inner cannula, and replacing your old trach ties. I will lower this. Do you have any questions?
Nope.
Do you have any allergies?
No, not that I know of.
Okay. Okay, so I will just be positioning my equipment here really quick. I will be first doing a respiratory assessment. Okay, can you just I'll just have you breathe in with me. Before I do this, I would have raised the bed and angled him at an appropriate angle. Okay, breathe in for me. Breathe in. 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 Okay. Now what I did is I did do a full respiratory assessment on the anterior, lateral, and posterior sides. I will, but as simulated. And there is a need for suctioning, so before we do anything, can I have you just to mobilize your secretions? Can you give me a couple of coughs? Okay, thank you. So at this point, I will be hyperoxygenating my patient here, turning on my suction, putting this here for later, performing hand hygiene. Okay, so as determined, there will be a need for suctioning, so I will be readying my sterile field. I have my trash can right here. I have my little bowl here. I will also be opening my care kit set. Putting my saline, making sure that I'm not breaking sterile field. But having all my equipment ready and open. Okay. So keeping my sterile field, I will now apply my clean gloves.
Oh, okay. So we'll put it here. We'll go ahead and I'm going to take this off.
I do have my suction here. Okay. I want to keep the suction on my left hand here because I will be using that for mobilization. Now with this hand, I am breaking sterile field. This will no longer be my sterile hand. I will be taking off his oxygen and attaching my suction, making sure, as I did earlier, it is on full suction.
I just moved this out. Are you ready?
Okay.
Okay. I will be testing my suction here and my saline boat. Thank you. So my suction is working now. Now I will be putting it into his inner cannula, stopping if I feel any resistance, but I will be going no more than 6 to 8 inches. With the markings here, that's 15, 20 centimeters here. Okay. Now that I've reached my point here, I will start suctioning, moving around the suction, making sure I get all sides. Going for at least 10 seconds, but no more than 15. Okay. I am keeping this sterile. I will be doing a full assessment of his respiratory again, just to see if there is a need for resuctioning. This is my non-sterile hand, so I will be using that to listen here. So can you give me deep breaths again? Deep breath. 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 Okay. I will also do this for the posterior side. And I did a full respiratory assessment on his lateral sides as well. And there is no need for further suctioning. If there was, I would have suctioned and cleaned out my my catheter here in the saline boat. So I could just dispose of my equipment now. Put this into the trash. Okay. Perform hand hygiene. Sorry, try to fix my mask. Perform hand hygiene. While I'm doing this, I will also monitor signs for hypoxemia. I will replace his oxygen, making sure that he has a few minutes to rest because of the suctioning. So he is doing good. His skin is good. Give him a couple minutes to catch up. Here, I'll be setting up my next procedure, which is replacing the equipment here. Replacing and cleaning. Hand hygiene. I will be donning clean gloves. So now that Mr. Doe had a couple minutes to catch up and re-oxygenate, I will be removing this, making sure that I'm only touching the white part of his inner cannula, replacing it, and I did fill these with the sterile solution earlier. Have that set. Remove my clean gloves. Hand hygiene. Now I will be doing applying sterile gloves. Okay. Okay, so I do have my clean gloves now. I want to put my cleaning pipe here. Okay, I will be disposing of this. So I do have my sterile location here. Making sure that I'm only grabbing the white part of the inner cannula. doing a full thorough cleaning. Okay. And then drying it off with my pipe cleaner. Okay. I will now reattach my inner cannula. Here. I am no longer sterile, but I could continue to assess Mr. Doe here. I will be assessing his stoma and peristoma areas, which are pink and moist, and no signs of infection. Making sure that my patient is also without signs of hypoxemia or hypoxemia. Next, I will attach my U-gauze here. Oh, well, I guess before I do that, I want to clean the area. So I'll be cleaning both the top and the bottom. And applying my clean U-gauze here.
Respiratory assessments, the patient's tolerance, and sputum amount and color.
I have a clean Trach tiger that I will be replacing his old one. So can you help me lift your head a little bit? Yeah. Before I remove the old Trach ties, I will be attaching the new ones. Okay, that's securely attached. Now I could remove my old ties here. Disposing that and my gauze. Throwing away all my equipment. Okay. I want to return my patient here to his oxygen, making sure that everything is properly in place, returning him to his ordered oxygen amount. Have my suction off. Now before I finish, I will document the patient's tolerance. Mr. Doe, do you have any pain?
No.
Okay. I will also assess his pain, the secretions that I did, the assessments, the respiratory sounds, which I will reassess here in a bit. I also would assess the sputum that had came out in the suction, the color, and about how much, which is hard to tell with there was saline solution in there. So I will do one more respiratory assessment here. Can you breathe in for me? Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Deep breath. Deep breath. And I will also do that on the posterior side as well, as I did it on the lateral sides. So the airway and the sounds were clear. So I will be putting that in the chart as well. And raising the bed rail, making sure that he has his call light. Is there anything else I could do for you, Mr. Doe?
No.
Okay. Thank you.